Okay, great. Well, I think let's get started, and then hopefully some others can join us as we go through. It'll be quite an open discussion, so it doesn't matter if people come in and join us later on. My name's Rose Penfold. I'm a junior doctor based in London in the UK, and I was previously a medical student at Oxford, which is how I got involved initially with the OxPal-MedLink, and helped to direct the partnership when I was a medical student based in Oxford. I think probably all very aware, Palestine's a very unique sort of geopolitical context, both to be studying and practicing medicine. And so I think in today's journal club, we wanted to look at a couple of papers exploring this and to discuss some of the issues raised by those, and also, of course, your own experiences of studying and of practicing medicine in that context. So I hope that sounds good. I think most of you are muted currently, but you should all be able to unmute. So I think it would be really, really good if we can have some discussion throughout. I'll leave the chat panel up as well. So please feel free. Can everybody see the chat panel on the right? Make sure your screen's, make sure your screen's configured to see that, and then we can all, you can type on there as well with any questions, suggestions that you might have as well, to make it as useful as possible. But obviously I'm very keen to see how this paper kind of reflects your own experiences, and whether you think it actually is a good representation of some of the challenges facing medical education and practice in the West Bank and in Gaza. So I think a couple more people are joining us, but that's absolutely fine. Just join in as soon as you can. So I guess the first thing, I hope everyone's had chance to have at least a look at the paper. I can share my screen if people haven't, but I hope everyone's got a copy of it. Is that the case? Has everyone been able to see the Medical Education in Palestine journal article? Or does everyone have a copy of it? Yeah. Okay, good. I'll just post. Let me just post the link. And also of a paper that our group wrote a few years ago on our experience with the OxPal-MedLink. So I posted the link to that in the chat panel as well. So hopefully you can all see that. Okay, great. So I guess let's just start by talking firstly a bit about the paper itself and the study design. So this is a paper based on authors. It's written by authors based both in Palestine and in the UK, and uses a sort of semi-structured interview format. So the paper has 21 participants from Palestine and from the UK. So I was just wondering if anybody had any initial thoughts on that, in terms of, do we think that's a representative sample? What do we think of the methodology used in terms of getting a good understanding of the context in Palestine? You may need to unmute if you're muted to speak, or please type in the chat panel, whatever is easiest. Everyone's very silent. I'll unmute you all. There you go. Let's see.
I'll swing around your side of the table.
Okay.
What's going on?
Yeah.
to get Rose's screen, small screen. Oh no, I can't. Can
Can you? Everyone's still muted. How do I?
Stop sharing the screen.
I? Oh, Rose, have you stopped sharing your screen?
I can share. I'll share the screen. Yeah.
Nice
Yeah.
to look at, you know.
Yeah.
You've got
There you go. Should be able to see it now.
and
Yeah.
everyone else should unmute their mics as well, right?
Yeah. Everyone else should be unmuted possible so that we can. Yeah. Excellent. I think most people are muted now. Great. So, can everyone see the paper up on the screen? Yeah. Great. So, this is using semi-structured interviews from participants in the UK and in Palestine. So I was wondering what people thought about that as a sort of study methodology, and whether we think it's capturing kind of representative views of those practicing medicine in the West Bank and in Gaza. So I've got the, there we go, I've got the method bit up at the moment. So the information in this article comes from a range of sources. So 2 authors have conducted most of their medical education in Palestine and have extensive first-hand experience. The other conducted a series of semi-structured interviews. So what do people think of that in terms of, do we think that's a representative sample? And if you were doing the study, who else would you like to interview to get some more information?
Rose, there's still a bunch of people whose mics are like muted.
Yeah, I've seen it.
Unmute them, or do they have to unmute themselves?
I think I should have unmuted all, but I don't know whether they've.
Yeah, I think the problem is that they have to accept that. So you can mute, but then if they don't accept that, it's not gonna work.
If I press unmute and they don't accept,
Yeah, exactly.
Okay, so all those who are muted, I think you'd like to unmute. Okay, and while we wait for them, is anyone who's unmuted got some ideas on who else they would like to have interviewed as part of the study if they were conducting it?
Yes.
Everyone's very quiet.
You've got the perspective of the people being taught, but not necessarily the people teaching themselves. So there's a couple of people who've had medical education, so they have an experience of how medicine is taught.
Yeah.
Someone who's been interviewing those involved in health and education, but you don't have the perspective of somebody who's meant to be teaching and isn't. So with the lack of qualified teaching staff, it might be interesting to interview some of those teaching staff.
Yeah.
Whether or not they feel like they are not being adequately supported to be teachers, or whether or not there are outside barriers that are stopping them from teaching effectively, like, I don't know, time shortage or lack of resources or anything like that.
Yeah, I'd agree with that. So we've got sort of one side of the story here, haven't we? Because we've got those who are receiving the teaching, but not so many of those who are actually delivering it. We do have, the sample included 2 heads of clinical departments, but again, it's unclear whether they're also medical educators or whether they're just mainly clinicians. And again, the person who worked in the leadership role for an NGO, again, we don't know that much about their background as well. So that's useful. Does anyone else have any thoughts about how else we could have obtained some more representative views as part of this study?
Well, I think the 8 medical students, it's not very specific, like which year and whether they are in the basic, like they are still in the first 3 years, or they are the clinical students who are in the hospitals, because it does differ sometimes.
Yeah, okay, that's a good point.
Teaching institutions are 3. We've only got 2 out of the 4 institutions represented.
Yeah.
It might be also interesting to look at whether or not the sort of the older institutions have better like teaching provision. So whether or not it's just a matter of the newer institutions being still in more of a setting up phase versus ones well established, perhaps delivering better teaching. I don't know which of the two that were picked, whether or not they are the older or newer institutions.
And there'll be some difference between them.
Yeah.
And I guess it's interesting to think about when all of the medical schools were actually created in the West Bank and in Gaza. So the medical authors obviously talk about the fact that until recently, most medical trainees trained abroad, and it's only recently that trainees, or relatively recently, that medical students have been able to train in Palestine itself. So it's still very much an evolving landscape. That's good. And again, so we talked a bit about the participants. What about BKW observed 12 teaching sessions? Do we think this is an adequate number of teaching sessions to observe, to draw conclusions from, or is there some more information that we'd like about this?
How long over, what kind of period of time were there 12 sessions? That's an interesting thing to study as well. If it's 12 sessions over 2 months, then that might be insufficient teaching in and of itself, because it's not very much. 12 sessions over 2 days or 3 days or even a week is a fairly large amount of teaching. So I think it would be nice to know whether or not they were observing teaching over a period of time than just a number of sessions, because that's more of an indication of the extent of clinical teaching providers.
Yeah. And what about the sort of informal debrief afterwards to gain feedback on the perceived value? Is there any more information that we'd like about that?
It's quite a
That's my fault. Oh. There was a feedback loop between our computers.
Yeah.
That was an accident.
Yeah. Sorry, would you mind saying that again? Didn't quite catch that because of the feedback.
It's quite a subjective thing, like measurement, and they don't really say exactly what feedback they were gaining, or whether it was structured, or whether it was the same for each of the 12 sessions. They could have maybe provided kind of an appendix type thing with a questionnaire that they'd followed each time or something like that, so that it's a bit more consistent.
Yeah, exactly. It'd be useful to see whether there's any sort of structure to that feedback, and also therefore how objective it is very difficult to determine, I think. And actually, if contrasting that with the paper we wrote a few years ago, where we were looking at the value of the OxPal programme, we tried to use as far as possible objective data to evaluate our programme, and we had both a semi-structured interview template for one-to-one interviews and focus groups, and also an online questionnaire, feedback questionnaire, which used a series of questions where the data could then be aggregated and actually analysed. So I guess that's different study designs, but I guess it also depends what conclusion you're trying to draw from the study, which is the most appropriate. And here, if you're it might well be appropriate to have quite open questions, but obviously that does limit the findings to some extent. Okay, cool. So let's move on to talk a bit more about what the study found. So the authors give a background to Palestine in their view, and some of the historical context behind it, and then also talk about healthcare in Palestine. So one of the first things they talk about is the diversity of providers and the fragmentation of the landscape, which can make coordinating education and setting standards difficult. So obviously there's a mixture of government hospitals, private hospitals, and NGO-led hospitals as well. So I was wondering whether anyone on the Zoom had any experience of fragmentation between different healthcare providers and how that influences healthcare delivery. You may need to unmute.
So is you mean like how does sorry, I just wanted to understand that I get the question right. You mean like how the fragmentation of the medical training does affect if you're having the training in the private sector or governmental? This is the question, right?
Yes, yes, exactly. So how
Okay.
training in different contexts will affect the sort of quality of that training, I guess.
Okay, so out of experience, I'm a fifth-year medical student here in Palestine. We do have a training in both like private hospitals and governmental hospitals, and it does affect the quality of the teaching because in private hospitals you don't have the full medical education because you're not allowed to, you know, have like, for example, a full physical examination or taking even history from patients because privacy for the patients comes first. And to be honest, they do care much about like what the patient says, but like just to be clear, in governmental hospitals, the patient's concerns and privacy, let's say privacy, the patient's privacy is not like a big concern. So sometimes like they keep telling the patient that this is a teaching hospital, so you must be having some interviews with the students, even though they sometimes don't want to. So this does affect the experience because the patient is not 100% consent about having this experience with a medical student, but even though they must do it anyway. And this is a better education for the student, yes, but it does affect the patient experience in this situation.
Okay, yeah, thank you for sharing that. Does anybody else have any experience of that, of differences both studying and practicing in government hospitals versus private hospitals or those run by NGOs? No? And maybe some of the differences in expectations between the different hospitals. Okay, so I think the next thing it talks about a bit is the sort of, as well as the different healthcare settings, talks a lot about the difficult and unpredictable financial circumstances, which can make sort of planning difficult. So one of the things the authors talk about is variation in donor aid and obviously in tax revenues collected by the Israeli government, which can sometimes lead to difficulties in funding and erratic funding in hospitals. I was wondering if people had experience of that, of funding difficulties in hospitals that they've learnt or worked, and how that's affected healthcare in those hospitals.
Say that again, Rose.
Yeah, so how funding difficulties might influence the quality of your medical education and of healthcare delivery in hospitals in Palestine. So have you experienced sort of contexts where funding has been difficult?
Oh, someone's replying in the chat. So.
If there's no funding facilities, And is the funding sometimes inconsistent? So sometimes there may be some funding and sometimes there may be no funding.
Yeah, so this is another issue because sometimes like some NGOs try to contribute to the funding of governmental hospitals. And this is inconsistent because it depends on like various, sometimes it's not very clear who's funding. It's just NGOs running like a fundraising thing. And because of non-funding, for example, like some hospitals don't have, governmental hospitals don't have like an EEG. So a student in such a block, like let's say neurology, is supposed to be exposed to EEG training, or how at least it's being done, and because they don't have an EEG, you don't get the chance to learn that, and the basics, how it's done, the results, it's all like up to you to go to the talks and discuss it in groups, but you never get exposed to the experience itself, because there's like some of the equipments that's supposed to be, they don't have it, so we don't have the training for that.
Okay. Does anybody else have any experience of that?
My experience is in the postgraduate training. In the postgraduate training, the doctors that are training, they depend on their salary, They don't have an extra salary for their training. So they do that by their offer, and by time they will get bored, and they will not provide the best education for students. I'm talking in governmental hospitals who depend just only to the doctors who are already working as specialists, and their own salary just only from the government, and no extra salary for their education in the postgraduate degree.
Okay. And yeah, I hear a comment about advanced cases always be referred for outside treatment. Is that outside of Palestine or outside of regional hospitals?
No, I'm talking in Palestine.
Yeah. Okay.
Especially Gaza.
Yeah. Okay. And does the difficulties in funding affect some of the population more than others?
I don't understand your question.
Yeah. So if there's difficulties in getting funding for facilities, are maybe poorer people in the population more affected by that than others who can find healthcare elsewhere?
I believe that both will be affected, the doctors that are in training and also the population that receive that facility.
Yeah.
Because yes, funding can affect these things.
Yeah. Okay.
Can I ask a question to some of the Palestinian students? What's the payment for university? Do you guys pay a university and medical school for your education, or is it free?
For undergrad, we pay money for the university, and they supposed to pay the doctors that are training in hospitals. However, in postgraduate, we are joining the Medical Palestinian Council, and we don't pay them except for the exams. So they don't pay the specialists. The specialists are doing that for free.
Right. So is there any difference of teaching provision?
Absolutely, yes. Absolutely, yes. Undergraduate degree, you have a program that you're going with and following. However, in postgraduate, you just only do a service job with no program, with no follow-up, with no background or feedback about your work. Just only the marker for our progress is at the end of the year is the exams. Which is written exams, and nobody can judge your work while you're working with patients.
Is there any qualification obtained then by an undergrad or a postgrad with your degree, or is it the same qualification at the end?
Sorry, I don't understand your question.
So you mean postgrad as in after you've graduated? It's the extra training that comes after you've graduated, basically.
Yes. In the postgraduate training, it's supposed to be a specialist after a few years to be a specialist, and they don't follow a program as in the undergraduate. In the undergraduate, the specialists are following a program from the universities because they pay them, and they're supposed to give lectures at specific times and do a journal clubs and. However, in the postgraduate, they don't do anything because they don't nobody fund them. They don't pay them for their extra work.
So you mentioned
I'm sorry, like
Go ahead.
Oh, thank you. I'd like just to ask something. Some hospitals do have like some kind of a residency program, like, and they do have like some kind of a journal clubs. They have like sometimes a rule where like sometimes the residency program does not supposed to be in at least 2 different hospitals. So I do believe there's some kind of variation. I don't know what kind of hospitals Bashar is talking about. Like it does exist, but I've been in a hospital, private hospital, where the residency program is some kind of better than that. Like they do have a logbook. Yeah, they don't follow them 100%, but they do have to do it in 2 hospitals. They have to spend like 2 months in the cardiology, sometimes in the emergency, sometimes in the ICU. So it's.
May I ask you, Shahid, where you were talking about, from in West Bank or in Gaza?
That's in the West Bank, especially in Hebron. I've been there, and this is the way they do it in a hospital here. It's some kind of a big hospital, yeah.
Yeah, but I'm talking now in Gaza, which is,
Okay.
I totally agree with you that in the system in the West Bank is better than ours in Gaza.
Oh yeah. I'm sorry about that. Yeah, I didn't know you're talking about Gaza. Okay, good to know, Asli.
Thank you.
And then interesting to see, the discrepancy between, and I think you mentioned that funding, so doctors aren't paid to deliver the postgraduate training. Are there any other issues you think that stop doctors from being able to deliver postgraduate training in the hospitals?
Hi, Rose.
Oh, hi, Alfred. Yeah.
I just wanted to add something. I think there is a huge disparity inside Gaza, inside West Bank, and between Gaza and West Bank. Mm-hmm. So the thing is, we only have one university hospital in West Bank, which is the Najah Hospital. Mm-hmm. In Gaza, there is one, but it's not working at the moment. Now, it depends on the medical school. So we have 4 medical schools. And so, for example, I can talk about my experience working in Gaza, because I'm a graduate from the Islamic University of Gaza. Now, so in the undergrad, I agree. The university pays the tutors to kind of teach medical students. In the postgrad, they pay them per hour. That means that if you work, like just teach the students in the bedside for 2 hours, you get paid for it. I'm not sure about the Al-Azhar University, which is the second university in Gaza, but that's how the system works at IG. Now, even some tutors are paid, but then there's no motivation because they are low paid, and also they don't have dedicated time to teach medical students. So medical students end up, rotating in the departments, sometimes begging the tutors to teach them. Now, the good thing, we do have teaching assistants who try to kind of compensate that. And most teaching assistants are newly graduates, so that's mean that they don't have enough clinical experience to teach. So, for example, I worked as a teaching assistant, and I tried really hard to kind of do my best. But most of the time, you feel you don't have enough support to kind of teach students. So that's the main challenge in not having a robust kind of teaching system in Palestine, especially in Gaza. The other issue when it comes to medical education, especially in the clinical science, I think the main thing is basically we don't have a curriculum. We depend on textbooks that are written, authored from people from the UK, US, or Europe. And sometimes the evidence that they have doesn't apply to the local situation, local settings. So you have to just sometimes memorize, diagrams, flow charts that are based on, for example, clinical trials in the US, and you end up memorizing things and not applying them. So I think this is a huge challenge to medical education, especially for clinical students.
Okay, thanks for sharing that. Does anybody else have any thoughts they want to add at this stage?
Well, the experience is quite different in here. So you mentioned, as I mentioned, having like 4 different medical schools, and the oldest one actually, which is Al-Quds University, which is I am in, they don't have a hospital. There's no teaching hospital with the university. So they do distribute the students among different hospitals, governmental and private ones, throughout the whole West Bank area, Ramallah, Hebron, Bethlehem, Jericho. So this is like one more problem, because so let's say they are dividing the students among 4 different cities for the same block or the same rotation, which is like, let's say, internal medicine. So each one of them supposed to have the same basics, right? But because there's no, or like poor coordination between different doctors or different supervisors in these hospitals, they don't have the same experience, not even the essentials. So they end up having, some of them, they would have like a very poor outcome from that. And as he said, like we don't follow up with books that have statistics from Palestine, and studying UK or American books. Yeah, they do provide us the basics, and when it comes to the statistics, it's different. But I do think this is not big as the issue with teaching us, like, not in a community-based manner. Like, it's always about the doctor who's telling us, and it's more about you, not the patient. It's not community-based. It does not, like, I don't know how to say it, but it's just like it doesn't produce, it does not end up with a medical student who could function well in the community.
Yeah, totally agree. I think because doctors who are working in the hospital, they assume that they don't have responsibility to teach medical students. Because they are not working in a teaching hospital, they are working in a governmental hospital or a community hospital that is not meant to kind of have medical students working alongside the team in the hospital.
And so I guess a broader question, and kind of relates to what you were just saying, do you think that the medical education, undergraduate medical education in Palestine, prepares you well enough for clinical practice in Palestine and for treating patients in that context?
I don't think so. And the university probably know that. I know from my dean and his advisor that they are working on a proposal to make it work for graduates to have, like, to be really good functioning once they graduate. So I don't think so. Like, I once had a training outside the context of the Palestinian educational system, and it was way different from the way it's being processed in Palestine. So it's always about the student being able to have the basics when they graduate, and in Palestine it's not that way. And this is very obvious once we graduate and we do have 1 year of internship. Like, there's a huge gap between, and even though we had these 3 years in the hospital, they don't function well. They do have like 2 months trying to be part of the team and be part of the staff, because as clinical students, they were not part of the staff. They were just mainly observers. And it also depends on the supervisor if he wants to make the students part of the team or not. There's no law that force him or not.
And why do you think that is the case? Is it a culture thing? Is it because that's the way it always has been? Or is it, why are students not involved very much in clinical care of patients?
Okay, so when it comes to the training, it is like 90% when they are training in private hospitals, they are kind of guaranteed that they will not be part of the team. They are really concerned about the patients, and the teaching comes not as a priority. In the governmental hospitals, it's different, but it's just like there's no protocol. So it also depends on the supervisor if he wants to get the students more involved or not. Sometimes it depends on the student. They do have to have that initiative, but no one will like ask you to do something as you're part, like you're not part of the staff. So I'd say like to end up that it depends on the supervisor. He's the only one to decide how much the medical student can be involved or not.
Okay. So quite often it's just the medical students will just come and observe the ward rounds, etc., and not necessarily actively be involved in care. Does that mean when you start as an intern or as a doctor, is it scary doing so if you don't feel you've seen patients much as a medical student?
It is just scary because we have seen these patients, but we were just like doing physical examinations, histories, but nothing like more. You wouldn't be allowed to do like on an ECG on your own always.
Okay.
So you were not like that much involved. And now as an intern, you have to do it on your own. You have to get the patient from A to Z on your own, kind of. It depends on where you're doing your internship, honestly.
Yeah. Okay.
If can I mention the interruption, the involvement of the students? I'm studying now in Egypt, in Alexandria, and I had a elective opportunity before in Gaza, in Shifa hospital. I am studying in a hospital that is a university hospital. We have like better abilities or better involvement, but it always depends on you to go or to get more to get in touch with the patients. Like in Gaza, it was the same, but maybe the supervisor was not that helpful in that time. But like if we are like comparing the hospital, the university hospitals with the governmental hospitals, because I tried both. The situation is always depending on you to like get involved, get involved with the patients. So maybe the situation in Gaza, like the doctors are not that in interest to teach or something. But if you ask them to teach you, or if you ask them about the details of something or any operation they did, or during the operation, they will be happy to describe or to explain this for you. That's a point that maybe be helpful to be discussed.
100%. I agree with that. I think it's the issue is twofold. First thing is with not having a university hospital. Of course, I think this is a huge issue in Palestine, and that excludes Najah University Hospital, of course. The second thing, of course, the kind of medical students themselves. There is a huge issue in, and I'm not like trying to say like some students are bad and some students are good, but there is a huge issue when it comes to selecting medical students when they graduate from high school, the equivalent in the UK, or Tawjihi, what we call in Palestine, because we only rely on their cumulative GPA or their final grade in Tawjihi exam or the final exam in the high school. So we end up having students who are really hardworking, but some of them, and I noticed that in a couple of kind of people who I know, they don't have interest in medicine. So sometimes they don't have enough motivation to go and, to take an extra step to kind of observe certain procedure or do it by themselves. So I think there's two issues in that. And which is completely different from, for example, the UK or in the US, where you have kind of different kind of quality control to make sure that we select the best students who are who will be the kind of best future doctors.
And touching on that last point, you mentioned about selecting the best students who will be the future doctors. Do you think that the admissions process to medical school currently does that, or do you think there's room for improvement there also?
I think, I'm not sure about West Bank, but I think that's the case in Gaza, where we only rely on a cutoff. For example, if you get 97 or 98 in your kind of certificate or GPA, you are guaranteed to get into medical school. And of course, if you have money, because you have to pay for the tuition fees, and there are no scholarships except like very, very few selected cases. So having a high grade and money, I don't think it's a good kind of criteria to kind of to become a good medical student and then a good doctor. I think the model in other kind of high-income countries is way better, because when you pass certain kind of exams or like an interview, you can have these kind of quality control measures in place. But from my understanding, we don't have interviews. Sometimes they do interviews, but they are only just kind of just to say that we did an interview, but it doesn't kind of actually change the decision.
Can I ask a question in response to that then?
Sure.
Having sort of limited capacity or bandwidth for clinical teaching, is it better to use the time and resources for improving the application process and interviews and stuff like that, or is it better to focus that time and money potentially on improving the clinical teaching provision?
I'm not sure if I understood your question, because there was an interruption in the connection. Could you please just repeat this?
Yeah, so my question is, if there's already stretched resources for clinical teaching,
mm-hmm.
is it worth trying to improve the quality of the admissions process first, mm-hmm. or is it worth trying to improve the quality of the teaching and try and engage potentially better candidates? Because if the clinical teaching itself is not that clinically focused, it's more academic or didactic learning or book focused.
Yeah.
And I think naturally attract people that are good at getting high test results but aren't necessarily going to be good doctors. Whereas if you improve the quality of the clinical teaching first, then you're more likely to appeal to people for which the clinical aspect of teaching.
Yeah.
Does that make sense?
Yeah, 100%. I totally agree that you have to build a good medical education system first. And then when you have this in place, then you select students based on a more robust criteria. And I think that's the case in many kind of good medical schools around the world. They build a good system, and then they kind of improve their selection criteria. And I remember, because we had like some improvement in medical education. I remember when we started the first medical school in West Bank, Quds Medical School, and I hear the story. They used to kind of accept everyone after a certain kind of cutoff, but then later when they improved their teaching system, they had more kind of select criteria to choose medical students, and that's the case in Gaza. But still, I don't think it's enough, and it's fair to kind of just rely on certain unfair, I would say, criteria. And maybe Shahid can correct me, because she's from Al-Quds Medical School.
Okay, so they don't have a selection criteria, honestly. It's the same as since whenever, like it's the same as for me. I'm a fifth year, and it's the same as my cousin who's in the first year, and even the numbers are rising. Like 6-year medical students now are like around 70 students. 5th-year medical students are around 180, and the numbers are rising. Some are 300. So it's coming more above business, because there's one more medical school that was established 2 years ago, yeah, in Hebron, and it's getting a lot of numbers, like 300 students since the first year, which is a huge number. And this is where Al-Quds University and also An-Najah University changed like the cut point, and to be honest, they manipulated even the numbers just to get more numbers and economics, more money for the university. because they knew it will affect them having a new medical school in Hebrew.
Yeah.
And I guess something else that the authors talk about in the paper is talking about some of the geographical barriers to accessing teaching and learning. So in particular, the checkpoints preventing students and postgraduates from accessing hospitals and clinical learning environments and obtaining permission to cross borders. Is that something that any of you have experienced it, and does that affect your education also?
Yeah, 100%. Like, so in Al-Quds University, they do have 2 teaching hospitals in Jerusalem, and they do provide some kind of a like permissions throughout the whole academic year for the students to go there. So the first point is some medical students are not permitted to go and have a permission in the first place, and this is a variable number. Like in my like colleagues, there are 2 medical students who are not allowed to have that permission, and some blocks and some rotations are mandatory to be done in Jerusalem. So they can do these rotations, and it's up to them. They can stay at home. They can like voluntarily go to somewhere they know. And this is not like small blocks, like some of them are 6 weeks, and this is like in 5th year we do have 12 weeks mandatory in Jerusalem, and these 10 students are not allowed in. So this is the first point. A second point is whenever there's like sometimes of you know, ups and downs and it's not very smooth, and you do have your permission anyway, and it does like have a stamp on the permission that you are part of a medical training and you're on a mission, you're part of the staff, right? And even though they don't let you through the border or the checkpoint, and you have to go back home, and this could be a week, could be 2 days, you don't know, it's not always clear.
Okay. So I know a few others have joined us, which is great. So we're just talking about some of the sort of geographical barriers to accessing sort of hospitals and learning environments. So I wondered if anybody else has experience of that and how that's affected their medical education and or clinical practice. Okay. Feel free to type the response or to speak.
It does. I mean, one more thing, I think it's just because like we've been living with that, we don't realize that, but it does affect our time management skills. Like for you guys, like for example, in the UK, you have to wait in the bus station, and you do have that like kind of a board that tells you the bus is coming in 4 minutes, and oh, it could be maximum 5 minutes, and he's coming, and you know what time exactly does it like departs and leaves. But in here, you don't have good management of your time because you don't know how much time you're going to wait on the border or the checkpoint. You don't know when it's closed. Like sometimes it closed out of nowhere, or they are in a bad mood today. Like sometimes it could take 2 minutes crossing the checkpoint. Other times you end up with a moody soldier and you have to wait for 30 minutes. So you don't have good time management over your time.
Mm-hmm.
It does affect a medical student. I mean, having 2 hours to Jerusalem or having half an hour to go there, it does affect you on the long term. It's just because it's an everyday experience, you never think about it.
Well, thank you for sharing that. Okay, so I guess in the last bit, it'd be good to think, we've talked about some of the issues that affect medical education and training, but it would be good to think about some of the solutions or some of the ways that we might think about improving this. So I think one of the things that the paper mentions is talking about more peer-to-peer learning. So maybe older medical students teaching younger medical students, and that could be an effective way of enhancing medical training. I was wondering if anyone had experience of that or thought that could be a helpful thing.
So yeah, this is an active point, and it does help in so many ways. So older medical students in the same hospital, they do help younger students, and like it always depends on their initiative, and it's quite helpful. Like this year, for example, they do have like a group of medical students made a mini OSCE for fourth year medical students, and it was like way more helpful for them because, you know, OSCE is a first time experience and it gets very stressful. So this is one point that gets things easier. They're helping us as for the sources, how to get most out of your block or rotation, and you know how to manage your time and as a clinical student because it's different now. So yeah.
Yeah, okay. Is there something that anybody else has had experience of learning from other students, so either direct peers or older students?
I think the peer-to-peer learning is also always depend on the older students has to be or has to know or has to had or some good experience or good clinical experience in the first place. Like if he know well, he will teach well. If he don't know well or if he didn't educate well, he will not teach well. That's the point I always like think about. If if I had some good clinical experience, I will like forward it to the younger. But if I didn't, so it's always be doubtful.
Can I just add something? I think peer-to-peer teaching is really, really important. But I think if that is kind of part of the curriculum, the students will be encouraged more to teach themselves. For example, I know in Oxford, like many kind of sixth-year medical students teach fourth-year medical students, and although it's not like a very kind of formal thing, but I think. And correct me if I'm wrong, maybe Rose and Kieran, it's really recommended from the medical school itself to have these kind of teaching sessions. So if we incorporate that in the curriculum, for example, if we encourage sixth-year medical students to teach for fourth-year medical students through several ways, for example, like any kind of prizes or any kind of gifts, I think that would be really awesome. Also, I think, and I can talk about my experience. I think participating in electives outside Palestine can give you a kind of an eye-opening experience to experience other teaching systems, and then that will change yourself, and then will reflect on other kind of medical students back home when you go back to Palestine. So I think it's very important, not only for you as a clinical medical student, but also for you as a doctor, and that will help you to plan your future ahead.
Yeah, I agree with Said. I mean, I don't know how these fourth years feel, but when I was a fourth year, I think about 50% of what I learned was from the sixth years teaching me and nodding. Obviously, that's true still. They, you know, when you first get to medical school, clinical school in Oxford, you have 2 weeks dedicated where the sixth years don't have anything to do and the fourth years don't, and you're supposed to, like, there's dedicated 2 weeks teaching time for the sixth years to teach the fourth years, all about how to do exams and how to take histories and so on. That gives them a good foundation so that when you go onto the wards, you like aren't just lost, and you're being taught by people who have a lot more spare time and a lot more free energy to teach you. And the sixth years also, it's good for them because it helps them revise the fundamentals of things as well. So I think that's one of the best things about medical school that I've had here, is having the sixth years teach me, and now me as a sixth year teaching the fourth years. I think it's been a really useful experience. So I would recommend that as a mechanism of peer-to-peer teaching.
Okay, great. And what about the value of online learning? So I guess here, both talking about using online resources maybe available from different countries, and also things like OxPal or web-based distance learning partnerships. Do people think those have value, and how can we best use them if they do?
Speaking from from my experience, I think there is certainly value in online teaching. but I would follow it up by saying, I think it needs to be paired with what Kieran was just talking about. There's reached a stage now where there's an almost overwhelming quantity of online resource, which is fantastic in some ways, but it becomes quite paralyzing if you don't know where to start and you don't really know what's relevant. So when particularly, so myself and Francesca are relatively early in our clinical training, and it's quite difficult to know now, you know, where is worth starting and where is worth stopping with what to know, what's useful to know. Because from this point onwards, it's kind of like, well, go forth and learn medicine. Obviously, that's when it's unstructured, that becomes really difficult. So if there's not structured help with knowing what's worth accessing and when to stop, when's enough information, what's relevant information for the types of clinical scenarios that you'll come across, I think that's a really key part of e-learning stuff. So the most useful clinical resources I've come across or I've used are not ones that I found my own Google searching. They're ones that I've been shown and personally recommended by other students. When they're personally recommended by slightly older students, then they're incredibly useful. So it's like, oh, have a look here. There's a ECG website that I was shown called Life in the Fast Lane that I've gone back to consistently because I was talked through it by a junior doctor who said it was really useful. And as a consequence, I will go to that. So I think pairing up, as Kieran said, like final years with slightly younger medical students is really, really useful for both clinical learning and then also for stuff like e-learning and handing down resources. A lot of medical students also produce their own digital notes. I don't know if that's something that you guys do as well, in which those digital notes are often passed down between people as well. And it creates, I think, quite a useful culture of people helping each other out with what's been useful to them before. And I think that more direct guidance is more useful than, you know, Google how to interpret an ECG and you know, spend an hour trying to find something that's useful to you.
Okay, yeah, thanks for sharing that. So I guess sort of the last thing I want to come on to is to think about how we can best use this link, so the OxPal link, and other links between sort of Palestine and other countries to best support local healthcare education and delivery in Palestine. So I'd be really grateful for any thoughts people have, both those attending from Palestine and also from Oxford, about how we best use this partnership. Done silence.
I could probably say something about this. So we're on the global surgery SSM at the moment, a special study module.
Yeah.
Asked rather informally by one of our supervisors, because they're in Tanzania at the moment, building a sort of research partnership between Muhimbili Health Allied Sciences, which is a uni out there, and Oxford Global Surgery Group, between the clinicians. But at the same time, we've been tasked with basically trying to come up with a student-to-student partnership that we think might be valuable to both groups. And what we've been discussing is in some ways relevant to OxPal, I think. The idea of doing like an intellectual exchange or an educational exchange. So as well as doing stuff like journal clubs, doing some shared teaching. So the ideas that we were brainstorming were doing sort of mini rounds to each other. So mini surgical rounds or mini medical rounds. So coming with a case that we'd come across in our individual clinical environments and then pitching those cases to both an audience of Oxford students, but then also an audience of Tanzanian students, so that would work equally here, because there might be different case presentations or different common morbidities and stuff that can be discussed. The second thing would be if we had tutorials with an Oxford clinician, for example, to simply just zoom in with one of the Tanzanian students or a few of the Tanzanian students. So the teaching exactly the same, but actually then you've just got people listening in from afar. And then doing vice versa. So if there was teaching done in Tanzania or here in Palestine, then us videoing in. So we're hearing the different kind of perspectives on clinical teaching. Obviously, it's best if this stuff is sort of reciprocal. So something that Oxford can give Tanzania and Tanzania can give Oxford. So there were a couple of things we came up with. I'm trying to think whether there was anything else. It was more just the idea of giving each other perspective of what being a medical student is like in the different environments, and then also some insight into, therefore, what clinical teaching is like, and what clinical scenarios are most common in those different environments.
Yeah, that sounds really, really exciting, Ben. Yeah, thank you for talking about that. Does anybody else have ideas on how we can best use this and other partnerships? Or what teaching would be most useful in either direction? Definitely feel free again to write in the comment box if you don't want to speak.
Someone's raised their hand, Rose. I don't know what that means.
Where's that? You see that? Oh yeah.
Hand icon.
Yeah. Oh, Hala. Are you able to speak? Can you? Yeah.
Oh, her mic isn't working, she said.
Oh, okay. Oh, okay. Do you want to type something, Hala? No rush. Or does anybody else have anything they want to say? So I think obviously we'll begin to wrap things up. But I think one thing that the study authors or Ben Winter talked about was that partnerships with advanced healthcare and education providers provide opportunity to build capacity that's not available domestically. So sharing of good practice and best practice from places like the UK or the US or from Europe via online training programs could be really beneficial, and that there is growing enthusiasm for that. I guess the only caveat to that is we want to make sure that any education and any educational partnerships are as relevant as possible. And actually, we talked earlier a bit about how medical education doesn't always prepare you well for practice in Palestine. And I think we have to ensure that anything we're doing is both relevant and very applicable to the specific challenges of working in Palestine. So I guess, we're obviously and I think that thanks, Bashar. Sharing updates and case discussions will also be helpful. Yeah, I agree. Yes, and Hala, thank you for encouraging local research conduction is also a useful way. So as well as building kind of local educational capacity, we also want to think about building local research capacity as well, and how we best do that. So I guess, yeah, as I was saying, obviously we want to try and forge these partnerships and encourage these partnerships, but I guess there's also the issue we need to think about in terms of how relevant that is and making sure it's locally relevant and applicable, and also some of the ethical issues associated with such partnerships. So I don't know if anyone has any ideas on what some of those ethical issues might be of partnering particularly high income countries with lower middle income countries, and how we can address those.
I think immediately, best practice can be quite a tricky phrase to keep coming back to, because best practice can be very context dependent, as you've already said. So if there might be a certain way of conducting a research study in an HIC like the UK, or even just in an environment like the UK because of the NHS, there might be specific like best done things that actually would not be very well applicable to a different context.
also just jumping on the ethical concerns thing, obviously is something that running OxPal I've had to think about a lot. And on a more basic level, I think it's been a lot. I mean, all of us have kept in mind quite a lot not to have this as a sort of exploitative thing where we're just getting tutors here to do teaching on OxPal once in a while so that they can say they've done it for their applications and so on, and actually have it be very focused on being useful for the Palestinian students. And I think we've tried really hard by getting as much feedback and changing things and trying to keep people involved and not making it sort of we're not really taking anything from them. It's supposed to be like productive for the Palestinian students, but I think that is a very thing you have to remain very conscious of when you're from a high income country teaching in lower income countries, and to sort of avoid that also savior issue that people have, you know, when they go on there from the UK classically go on gap years to lower income countries, and really the things that they're doing there are probably slightly more exploitative than they would like to admit.
Mhm.
And so, you know, I think do a very good job at the moment of doing that, but it's definitely something to bear in mind in those sort of information transfer type programs.
That's that. And does anyone else have anything they want to add or comment on? No. Oh, I've seen, yeah, thanks for your comment, Basha. Adding to Hala's point, training of trainee to conduct the trainings locally for other students and doctors. Yes, I think that's a really important point as well, and talking about the idea of building local capacity. So any sort of educational intervention, we have to ensure that it's ethical and also is locally sustainable and locally owned. And it's no good setting up a program that's going to be indefinitely reliant on resource from a high income country or on people coming from a high income country to teach. Ultimately, we want to make sure that any educational intervention is something that can be sustained in the local context as well, in the local environment. And actually online learning is one way that can be facilitated because it's quite low resource, but obviously have to make sure that is with a view to being locally relevant and applicable as well.
I think to some extent then that requires local ownership as well. And I think that demands as a sort of prerequisite that there's commitment from both sides to a sort of a minimum expectation of what both sides should be giving towards a collaborative project. If it's intended for the collaborative project to end up entirely owned by the local group, which I totally agree with, then I think that needs to start with saying we would expect a certain degree of input or commitment from everybody involved, including just attendees. So making sure that you know you're going to be there and you commit and you are there for a call, for example, or if not, there's an adequate reason, etc., etc.
Yeah. Great. So before we wrap up, does anyone else have any comments they'd like to make, both on the paper and on any of their thoughts about learning in Palestine and on educational partnerships more generally? No. Well, thank you very much, everybody, for dialing in today. I know it was a bit difficult at the start. Oh, putting expectations demands thinking about the difficulties. Okay. Could you elaborate a little bit more on that, Bashar? Just okay, like the acceptability. Okay, yeah. Okay. Thank you. Yeah, thank you for sharing that. Okay, thank you everyone for dialing in today. Sorry it was a bit tricky at the beginning. Sorry, still got comments. The geographic variation, is that within, do you mean within Palestine or do you mean globally? Or both? Between Gaza and the West Bank, okay. Yeah, which is something we talked about earlier, and it's not just one context we're thinking about here, but very different contexts even within Palestine. And I guess that also emphasizes the importance of making sure that anything we're doing is with local engagement and locally tailored, because it's not appropriate to think that one size is going to fit all in terms of educational delivery. Okay, well, yeah, please go ahead.
Yeah, can I add one more thing before we go? So you asked about, like, OxPal is running already like a fellowship training on research strategies, design, and questionnaires and so on. I think it would be quite interesting if they tried to bear like different trainees or students, postgraduates, I don't know, to do projects, research mainly. I think it would be quite interesting because the three, like Gaza, West Bank, and UK have three different like medical trainings or different experience in hospitals, and we would be interesting if they could end up having like one big research, or I don't know, like a research project that is shared between three of them. And I don't think the geographic barriers would affect that because the data would be online anyway for everyone. I don't know, just think about it, because OxPal does have a training fellowship for own research. Yeah,
that's an amazing idea. What do others think about that in terms of a collaborative research project?
Well, before you go into that, Rose, that was actually what we were planning on doing at the end of the research fellowship. Was
oh, okay.
There you go. Yeah. Can you talk any more about that now, Kieran, or is it a bit too early to say?
Because the research fellowship's going on for a while, it's under development, but we've been collecting a lot of data over the course of OxPal already, obviously, with that very large needs assessment and so on. And what the eventual intention would be to do either at the end of this research fellowship, or if we didn't manage to work it out this year, then next year. But the intention is definitely this year to do some of that data and some of the skills gleaned from that online in terms of things like data collection and all of the other things that we've been doing in our recent lectures, to have them implemented by some of the people who've been on our research course, with help from people in Oxford and Harvard, who hopefully write a poster or a publication or something like that collaboratively with some of the students in Palestine. Obviously, with the hundreds of people on the research course, it's very difficult. That's one of the things we're working on, to work out how you can't have that many people collaborate on necessarily one bit of research, but if we find a way to narrow that down or have multiple projects going, and that was another idea that we've been fleshing out and discussing recently. So that's a fantastic suggestion, and yeah, we're on it already, so great.
Excellent. Great. And does anyone else have any thoughts before we finish and I let you go? Okay, fantastic. Thank you very much for joining, everybody, and I hope you enjoy the rest of your day. If anyone has any other thoughts on what we've talked about today, please feel free to email us, get in touch at any time, and also sort of moving forward and thinking about how we best use the OxPal collaboration, and as Kieran talked about, some of the research collaboration that's emerging from that. So thank you very much for dining in. Thank you for all of your contributions, and look forward to speaking to you all again at some point very soon. Bye.
Thank you.
Thank you.
Thanks. Bye.
Thank you. Bye.